Hello, everyone. This is Dr. Mary Lauder, and you are listening to the Since You Put It That Way podcast. It's the show that examines various health, wellness, and medical topics from unique perspectives. We will be having discussions and guests that will cause you to pause and consider, well, since you put it that way. Welcome, podcasters. We are in our next episode of Since You Put It That Way. Today, we're going to talk about self-care and connection, finding our way through trauma to healing, health, and wholeness. In the last episode of Since You Put It That Way, I talked extensively about my own journey relative to grief, loss, well-meaning, but sometimes wrong, caring others, and how to listen to your own voice amidst the, essentially the shitstorm that you may find yourself in. And I talked about trauma therapy that I had both received and learned how to use, wherewith this benefited both myself and my patients. Today, I want to talk more about the concept of trauma and how you can not only work with a trauma-informed therapist, or in my case, a trauma-informed physician, but also learn the tools for self-care. Understand more about trauma, how it influences your life, how it may influence a medical diagnosis, and what to do about it. Primarily, this podcast is about hope. And I define hope as the following. First of all, hope is not an emotion, but it's a way of thinking or a cognitive process. Emotions play into a supporting role for hope, but hope is really a thought process made up of what a researcher with the last name of Schneider calls a trilogy of goals. And the trilogy of goals, or the trilogy of the component of what is involved in hope, is the following: goals, pathways, and agency. And what Schneider means by that, he means in very simple terms that hope happens when we can set realistic goals, like I know where I want to go. We can figure out then how to achieve those goals, including the ability to stay flexible and maybe even develop an alternative route or pathway to get there. I know how to get there. I'm persistent, and I can tolerate disappointment and try again, but I'm still going to keep going. That's the pathway part. And then believing in ourselves, the agency. I give myself permission, or I believe in myself that I can do this. So hope is a process. And the emotions come along with hope, but that's what that will be our framework today: hope in our ability to find our way through trauma into healing, health, and wholeness. So I was talking to a patient the other day, and they spoke of various difficulties in their life, and I'm putting this in air quotes, the various difficulties, as something that just happened in the past, and now I'm just going to focus on the future. And the challenge with that type of perception is that the trauma, or what the patient stated as difficulties, has a way of repeating itself because there's a resonance to it, the effects on our body, and trauma patterning just has this thing where it goes over and over again. And sometimes patients have reported that they see it in increments. Every 3 years, every 7 years, every 6 months, and they notice this pattern that occurs. So it's quite fascinating that we find this. And I think that's just one of the characteristics of trauma. I don't know exactly why that occurs, but it does. And one of the explanations is just the resonance or the energetics of it keep the trauma hanging around. So we kind of go back to that, whether it's a conscious or even a subconscious aspect or component to it. But trauma has its influence upon our nervous system. And in turn, that nervous system within our body is connected to, pretty much everything. So if we limited that connection to the neuroendocrine immune system, there we are, right back where it's actually influencing everything. So we've got that gut feeling that's around our intestines, and that's driven by an organ that's called the gut-associated lymphoid tissue. And there drives hormones, neurologic signals, inflammatory signals that goes all over our body, to our brain, our joints, our nervous system, different organs that are driven by hormones, such as, for the women, the uterus, ovaries, affects menstruation, PMS, migraines, pretty much everything. It's very complex. So the challenge is, how do we then unwind this? It's not just one trauma, one effect in the body, one solution. It becomes this web, this weaving, the intricacies. And so that's what we're going to talk about today, is how we can work our way through this and yet understand the beauty of how the body's all connected. So let's define trauma. What is that? Trauma is any event or a series of events that overwhelms our nervous system, immune system, emotional system, physical system. The key here is when I use the word overwhelm. And overwhelm indicates that we've shut down. We can't respond. And in the nervous system, it looks like one of the following: fight, flight, freeze. So trauma is a result of either something that's been done to us or something that we did. There's no difference between the two. The body sees all of this as trauma. And the other part that's pretty fascinating is that trauma changes our brain. It changes the pathways. It changes our neurotransmitter, our brain chemicals. It changes our perceptions and our imaginations. So this occurs because the trauma has not been processed or allowed to heal. We suffer from our traumatic events, whether that be in our mind, emotions, or our body, or our spirit even, but that's all housed in our body. The body, which is basically a highly organized bag of bones and flesh, suffers because of trauma. So today I'm going to give a higher level explanation, and as our podcasts go forward, we're going to have invited guests that are going to come, and we'll be in conversation about different aspects of the trauma, different aspects of the body, and different ways for healing and different components with chronic illness and things like that. But we're going to really kind of just focus in on what trauma is and how to deal with that. And remember, we're going to be providing hope. So at this point, I want to give a plug for our masterclass, My Anxiety Code. Check it out. It's on the website, because this is an excellent discussion how the brain works through some of these issues. Very important. The masterclass is no charge, and I put that together, and I think it's a well-presented topic relative to anxiety, how our body perceives anxiety, and then how we process things. We also have a new offering on our website that's put on by a colleague of mine, Lynn Swearengin. And Lynn is a friend and colleague of mine from Boulder, Colorado, when I lived out there and had my practice out there. And she has developed a program that's called How to Live and Understand Your Intuitive Field, or your intuition. And so take advantage of that. And that's also a free offering. And you might find, if that really speaks to you and get you all charged up, that you can do some one-on-one work with her. So check those things out. All right, now back to trauma. So with trauma, the brain gets stuck, and it's continually bombarded with information or triggers that flood up from the body to the area of the brain that's called the midbrain. In the midbrain is where the amygdala lives, the hippocampus, basal ganglia, areas that are involved, that they're not the higher centers. The higher centers are the prefrontal cortex. If you could see me now, I'm pointing to the top and the front part of my head. The brain stem, which is down around the base and the back of the brain, is where your breathing, your heart rate, all those are driven from. So that's the most primitive part of the brain. So in the midbrain is where the trauma gets stuck. That's where the triggers go. It's flooded up from the body because there's receptors. We store the trauma in our body. And whether it's the number of the traumas or triggers, the largeness of them, or the effect of them, the brain just runs these loops of old memories, which alters our perceptions and it alters our imagination. And these triggers occur no matter if the current events that we're facing are memories, if they're imaginary, or if they're real. The brain can't sort that through. It's just happening and it's triggered. So what we see in others or what we experience in our behavior is an overreaction, or maybe an underreaction if we go into the freeze effect from the autonomic nervous system. What others see when we're triggered is that there's an irrational response to a simple question or a series of events. The response or overaction that we do maybe and probably is way out of proportion to the situation at hand. And this leads to a lot of other feelings and even maybe like a shame spiral, guilt, dysfunctional communication, disrupted relationship, and on it goes. So as humans, we tend to focus on behavior, probably because we see the behavior and we figure that's overt, that's right out there. And most of us agree that the behavior has a consequences of either good or bad based upon what the behavior is. The theory of that, or the understanding of that on the consequences, it's called consequentialism. And this theory holds that in general, an act is right if and only if the act will produce or is intended to produce a greater balance of good over evil than anything that's available as an alternative. But the focus is on the outward action in consequentialism, not on the underlying emotions or reasons for the actions. Another concept of this is the love and logic approach to discipline. Well, Jimmy, if you do this, this will happen. If you do this, then you'll get that. And so while that's not meant to be an oversimplification, the emphasis is on the outward behavior. What we're going to deal with is the underlying feelings that pushes or drives the behaviors that we see. And mostly it's from trauma, and mostly it comes from things that are subconscious. So the goal is to unwind that and bring that back into consciousness, heal it, allow the nervous system to function, and then we can live a more fulfilled, content, peaceful life, right? And there's less pressure on our system, which is our body, right? So the challenge with this is that trauma and triggers from the trauma, they're not logical. And by and large, we try to be logical folks, and typically we should be able to logically sort things through. And that is if we're in our right mind, meaning our executive functioning is running the show. That's that higher prefrontal cortex that I was talking about. Otherwise, our midbrain's online and directing things from triggers and reactions. We can't even identify the feelings or emotions. We just react. Boom, we just are triggered and off we go. So my work as a physician, my work in understanding trauma, and my work that I developed in the protocol that we're going to talk about doesn't focus on the external behavior as much, except to keep a patient safe, of course, and to deal with some maybe obvious issues. But rather, I'm coming at this is from where or what are the emotions behind the behavior. Whether the behavior may be acceptable or not, that's not really the motivation to the action. It's always emotions. It is always emotions that drive our behavior. And then it could be our backstory. It could be our history. It could be some genetics. So there's components to that, but it's always emotionally driven. When we hold this perspective of the emotions being the driving force behind our choices and our behaviors, and it's filled with our backstory, our perspectives, things like that, it takes more time to work with people and to work with ourselves. And it takes more patience and connection to understand and to gain insight into why someone acts the way they do. Even if we're trying to figure out our own behaviors, like what is up with us, right? So it takes a developed emotional language to be able to identify and understand that which we are feeling. Well, this is a key point because we have to be keen on identifying and defining emotions. And when we do that, we have found, and the research shows relative to emotions, that this has been a way to be able to live a rich and full and more fulfilled life. So we have better life experiences. One of the best books I've ever seen and explanations I've ever seen about emotions is Brene Brown's book on Atlas of the Heart. And I've been a student of Brene Brown's for probably 8 years. And I think her work is excellent. It is tip top. And I just highly recommend anything you can get your hands on that she's written. And the books are just accessible, easy to read, and they're just excellent. But in this book, it's her newest book, Atlas of the Heart. This is a textbook that I use for my patients and clients. And her research regarding emotions encompasses around 87 different emotions and emotional events. And this contrasts with the average person being able to identify only 3 different emotions: happy, sad, and pissed off. So think of it this way. If we were only able to describe an amazing vacation or experience given 3 words, you could see how limiting it would be. And not only for us to experience it personally, but how limiting it would be if we were trying to explain our experience or fun or adventures to someone else, right? So you're literally hampered in your connections to yourself and others if we don't have a rich emotional experience. So, you go to the Caribbean, the beaches, white sand, beautiful turquoise water. You have these lovely beverages. You've gone kayaking, snorkeling. The winds have been beautiful. The waters. How would you explain that? I was happy. Then on Tuesday, I was sad. And then when I had to check out, I was pissed off. I mean, seriously, no, it's like the sand was so great. It was, it just felt so good within my feet. It felt luxurious. It felt warm. I was happy. So you can see how just understanding some basic emotions changes your ability to experience what you're experiencing and your ability to share that with others. Dr. Bessel van der Kolk has written one of the more definitive books on trauma. The title of that book is The Body Keeps the Score. And I highly recommend this book. It's a bit of a read. It's kind of heady, but it's good. And he states the following, which is also the key to part of the work that I do with folks. He says, for real change to take place, the body needs to learn that the danger has passed and to live in the reality of the present. And we can only truly live in the present moment, right? We can't live in the past, live in our memories or regrets of what happened, and we can't live in the future. We can only occupy the present moment. So, but we're often beset and we tend to dwell either on the past or focus on the future. Like the patient I was talking about earlier. Yes, things happened in the past, but I'm focusing on going forward. Meanwhile, she was paralyzed, not knowing or understanding what was going on with her, why her life and emotions were hard, why all of a sudden she was faced with a major diagnosis that required specialty care, 2 or 3 different medications, and her activities of daily living were so hampered that her joints were just so swollen and sore, she just couldn't function, right? So we're often beset and we tend to dwell on either the past or focus on the future. So the key is for us to find that safety in the present moment. And Dr. van der Kolk describes the safety when he's talking about the body learning that the danger has passed and it's okay to live in the reality of the present. Trauma teaches us that it's not okay to live there. Trauma teaches that it's not safe to be connected there. Trauma teaches we got to separate. We've got to get away from that because that's too painful. As humans, we need to know that our environment is safe and that we're safe inherently. And that's the whole fight or flight thing anyway. And that's how that works. And that's why it works so well. And we're wired for survival because, well, we need to survive. So that's innate to us, right? And what's also innate is the body's ability to heal. So this is a key point. It's innate for our bodies to heal, and we're wired for survival, and we're wired to heal. That's a pretty good combination, but how does that work? Well, what we know is that based upon advances in neuroimaging, neurobiology, neurophysiology, Energetic medicine, and coupled with the limitations of psychotherapy and modern psychiatric medications, so there's limits there. Those limits and those advances combined have caused the curious healers to continually search for more answers. And I'm one of those curious healers, right? This has brought about a new understanding. That's the trauma-informed care. So today, for our purposes, we're talking the mind-body connection and paradigms of trauma-informed care. As humans, we have basic needs. We all have common experiences. No matter if we're seen or labeled as a world changer or common man, we all eat, sleep, attend to hygiene, and must pay the bills. This is a shared common humanity. We all want comfort. We all want to be comfortable. We all want to be comforted. We all want to be seen, understood, loved, and we're hardwired for connection, love, and belonging. Research by many, including Brene Brown and others, clearly delineates this. What happens in trauma, and remember that definition of being overwhelmed by an event or series of events, whether it's either real or imagined, usually both, but the residual is usually the imagined part. By then, with that trauma, we're disconnected from ourselves. And that occurs even just a little bit or more often by a lot. So that separation from ourselves is a term that we use that's called dissociation. You separate away from where the trauma occurred because it's not safe to be there. Remember, we're hardwired for survival. We're hardwired for being able to heal. But how do we do that if the trauma occurs and breaks that? We separate or dissociate. It's how we find our safety. Dissociation has this continuum. You could be a little dissociated, a little beset, a little bit beside yourself, or so disconnected that you fill that void in between with behaviors that somehow work to keep us connected in some manner. These behaviors are things we've become to pathologize, like personality disorders, borderline personalities, split personalities, multiple personalities, addiction, always being the victim, mental and emotional strain, anxiety, depression, and simply not knowing what we are feeling, or as we may call it, just going through the emotions. Now, hear me as a physician. This is complex. This is not to reduce just everything to, well, you should know better, you're just dissociated. No, dissociation is very, very complex. It's one of the hardest things to identify because it's hard to see. And what we know, if we apply the principles of all trauma causes some dissociation, we begin to bring connection, where we can reunite the person back into the present moment. Okay, so great. That's a lot. How again? Then let's just cut to the chase to see how this works. As an osteopathic physician, that means I have a DO after my name versus an MD, we learned that the body has the inherent capacity to heal. I think the MDs learn that too, but our philosophy of thought is that the body is connected. The body has the inherent capacity to heal. The structure and the function of the body work close together to keep that going. When we cut our finger, it heals. We apply the principles of first aid, but the body really does the work. So it's like I get a cut on my finger and then, I'm supposed to go out to the movies that night. And I can't say, I can't go to the movies. I have to sit around home and watch my finger heal. So I have to you go to the movies, put a Band-Aid on, keep your finger straight, whatever, keep it clean, and it's going to heal, right? Well, what if we said the same is true for our emotions? That's an interesting paradigm. So let me say it again. What if we say the same is true for our emotions? We apply some general principles. We access how the body can heal the emotions, but we let the body heal our emotions. I think this could be a new perspective. So that brings me to say, since you put it that way, right? Since you put it that way, I believe this might be a changing paradigm of thought regarding healing. And here's why I think that. We think of our emotions and then we think of our health. I'm curious if we're picturing them in a side-by-side concept. Are we thinking our emotions run parallel to our health, parallel to our body, but just kind of slightly outside of? Meaning, I've got to get emotionally better and I have these other diagnoses. I don't see it any different. I see taking the pulse, taking a blood pressure, a temperature, oxygen level, those are called vitals. Why? Well, they're vital, right? So we've labeled those as vitals. Well, what if the emotions of sadness, despair, anguish, joy, fulfillment, what if those could be vital feelings too? What if the more we know our emotions, the better we understand how we feel and the more connected we are? Do you think that that would have an influence on our health? I think it does. So these emotions, then where are they? Well, I think they're in our body. I think we feel them. I think we experience them. I think they're stored. Now, I can't exactly prove all this, but Dr. Bessel van der Kolk talked about the body keeping the score. Some of the osteopathic literature talks about energy cysts or cells where trauma is held. And that can be whether it's a physical trauma, you had a motor vehicle accident, you strained your neck. It could be an emotional trauma that hit you somewhere, because sometimes, when something, devastating happens, you get a gut punch. Well, 3 months later, you develop indigestion, reflux, and an ulcer. Well, how are we making that connection, right? So that's something that we need to really look at and understand what the messages the body's telling us. So these emotions, they're in our body. So we can treat them by identifying them. And then when we identify these emotions, we can present them to the nervous system for processing and healing. There are tools that can help us with this. The tools that have been developed can be the following: any of these or all of the above. Cognitive behavioral therapy, EMDR, which is eye movement desensitization reprogramming, EFT, which is emotional freedom technique, TFT, which is thought field therapy, somatic emotional release, acupuncture, acupressure, craniosacral, advanced integrative therapy, or self-care and connection. Now, this last one I mentioned, self-care and connection, is the one that I developed. So that's the one I want to talk about today. But I will say this: having learned the principles of all of the above ones that I've listed, the self-care and connection that I developed really stands on the shoulders of all those other things that have come before. It's not something that came out of the blue. It came out of years of study, and it just came and was developed by my approach to listening, asking questions, and getting clarity by what the patient was saying. And that's how I found my way through it. And I found that the tool that I developed seemed to be really, really satisfactory towards care. So with these emotions, then, we identify them. Notice that I didn't say we have to go back and feel them all again, nor did I say we have to recreate the episode again, or the encounter again, or the experiences again. We simply acknowledge them. We identify them. Hopefully we can define them. We can feel where they are in the body. We can get a sense of that because right away something comes up. And perhaps we can even allow them to exist in the same room, as it were, but maybe elbows length away, not too close. And then we can present them to the nervous system. When we do this, we can observe that we have emotions without them overwhelming us. Again, maybe because they obviously overwhelmed them. That's the definition of trauma. And we present our emotions by using words, engaging certain points of our body. These are the energy centers or chakras. And those are defined, and we can follow a nomenclature and kind of an anatomy of that. And these emotions and the events are real, and they're part of us. So just like I can take a pulse by palpating the wrist or the artery that's in your neck, I can access these emotions by accessing the autonomic nervous system by using chakra points and asking certain questions. So here's what the self-care and connection looks like. It's a tool that I've developed, and it stands on the shoulders of all the others that I mentioned. And we're able to connect and reconnect with ourselves. So that's the connection part. And remember, the key that with trauma is that all trauma disconnects us and healing reconnects us. Or we could even say by reconnecting, we heal. So we are wired for connection, first to ourselves and then to others. So we have to come back to ourselves in order to heal, so then that we can have restored communication connection with others. The key to the healing, I believe, is the reconnection. The nervous system knows how to heal. We just need to present the nervous system with what it needs to be healed. It's kind of like a zipper. We get the ends lined up and then we pull up the tab and voila, the zipper works. Now, if it's not lined up correctly or if teeth are missing in the zipper, not so good, huh? But we undo that, we get it lined up. So that means that there's a few steps there. There's a few things we got to organize for the nervous system to take up through the body, process in the midbrain, and begin to compartmentalize it away more into the long-term memory and the healing part. And so then when we go into a situation again, we're not triggered. Our higher centers function. The executive center is the smart part of the brain. Says, hey, I've seen that pattern before. I know with a hot stove, not good to touch. Make sure the burners are off. And so we go, rather than going, oh my gosh, there's a stove. I don't know what to do. I don't know what to do. What's going to happen? What if this? So that anxiety goes down. Our ability to think and plan and make decision goes up, right? So with the self-care and connection, we always start the protocol with an even though statement. Why? Well, that's how I developed it. And because that's where we're at, and it's good to know that. And so when we start with an even though statement, we also use one hand to hold the heart in the heart center area and one hand over your solar plexus, which is just right below your sternum or your breastbone, because that's where your personal power is. When you hold those two spots, you're connecting the circuit. So it's like flipping a light switch. In order for the light to go on, the circuit has to complete. Turn the light switch off, the circuit breaks or stops. So when we hold our heart and we hold our solar plexus, we're completing the circuit. So the example goes something like this, and you'll probably want to write down the sentence, but I'm going to take you through this a time or two so you'll get this. You've got this. It says, even though, and I'm going to just pick an example, okay? Even though I have anxiety about an upcoming meeting with my boss, I deeply and completely love and accept myself. I choose to connect and reconnect with myself. And then I take a breath in through my nose and then out. And then I repeat the phrase, even though I have anxiety about my upcoming meeting with my boss, I deeply and completely love and accept myself. I choose to connect and reconnect with myself. Breath in and out. Breath in and out. And then I repeat it for the third and final time. Even though I have anxiety about my upcoming meeting with my boss, I deeply and completely love and accept myself. I choose to connect and reconnect with myself. Breath in and out. Breath in and out. Breath in and out. Now, the key with this and with this phrase and the breathing is the first time you say the phrase, you breathe in and out once. The second time you say the phrase, you breathe in and out twice. The third time you say the phrase, you breathe in and out 3 times. That entire process should take you about 90 seconds. And that's long enough for your autonomic nervous system to unwind or to switch from the fight or flight into the restorative mode. So you are literally applying a treatment when you do this. You're literally treating your nervous system. You aren't changing your reality. You're saying, even though I have this anxiety, even though I'm having a migraine, even though my low back hurts, I'm going to connect with myself. I'm going to love and accept myself, because the healing comes from the connection. Sometimes right after this, when you do this, another phrase pops up. So say you do this thing about the anxiety with your boss and you realize, oh my gosh, I have a headache. Even though this meeting with my boss just gives me a headache. Or I have a headache thinking about meeting with my boss, even though I deeply and completely love and accept myself. So there's usually a follow-up thing. And each time you do one of these segments or sections using this tool, you increase your connection to yourself. You increase your neurologic system's ability to process what feels traumatic and overwhelming to you. And most importantly, it allows us to connect and reconnect with ourselves, which is the safest place to be, present and accounted for. Less fight or flight, less cortisol, improved higher function, improved pattern recognition, and ability for our higher centers, our prefrontal cortex, to make decisions. So these are the beginning steps, and this tool will help diminish anxiety. This tool will help diminish the fight or flight response that you may be experiencing daily. And when I use this with folks, they're like, I didn't even know I felt that. I didn't even know I was that disconnected. Right, because that's in the subconscious. So we bring that through, treat that, and then all of a sudden we have awareness. So it's really pretty cool. So if this tool seems to work for you, which I know it works, but if this piques your interest, float your boat, connect with me or with a trauma-informed therapist or trauma-informed professional for more care and exploration. If there are significant traumatic events, sexual abuse, extensive verbal abuse, loss of loved one, things that just were so upheavaling in your life, work with a trained professional. Don't just try this at home, other than the initial connection to yourself, but don't delve deep into trying to fix things, because that's like saying, well, my right upper quadrant hurts right under my liver, so I'm going to just take my gallbladder out. No, no, no. You know, if something's bugging you, some basic good health things to do, increase water, decrease fat, increase fiber, change digestion, and then go get things looked at. So always use this with a professional, but go ahead and apply the basic principles to have that bring down the anxiety, to have you see how that connection can work. The self-care and connection phrase and the tool is safe to use, but just be careful not to expose yourself too much if there's a trauma that needs to be cared for. Life has its moments of joy and bliss, amazing adventure. The more emotionally we're connected and the more emotionally healed we are, the more we can feel. There's also times of great sadness, anxiety, and grief. It's a mixed bag. But the good news is we always have ways to process and heal from all of the things that get thrown at us, the good, the bad, and the ugly. So again, if this speaks to you, let's get connected. Let's do some work here coming up in the new year. I don't know the new year, new you's the thing. It's just a new year and some new opportunities for you to connect and heal. And the thing is, I tell my patients, it's not their responsibility to heal. It's their responsibility to participate in the process. And that's where the hope is important. The hope says, hey, I've got a goal. Hey, I've got a way of getting there, the pathway. And you may have tried lots of things, right? And so this is another pathway that I know has had very good results for folks. And you've given yourself the agency, the determination not to give up. So that's why I think that this work with self-care and connection is so hopeful. So I wish you all a bundle of curiosity regarding the self-care and connection process, and happy healing for all your emotional traumas and events so we can live connected to ourselves and others. Thanks for listening to today's episode of Since You Put It That Way. I hope that you found encouragement and a tool for a better and healthier life. Be well. We'll see you next time on Since You Put It That Way.
Thank you for joining us on the Since You Put It That Way podcast. Today's episode was written and produced by Crowded Table Productions. Technical editing, Malin Long Lopes. Sound editing, Jonathan Fiegel. Music, The River Jordan, written and performed by May Erlewine. Please rate and review our podcast as well. We appreciate your feedback, and hey, be positive, share the love.